like the heart can go into heart failure, the bladder can go into bladder failure, and you may need catheters for the rest of your life. And so often when we just focus on managing symptoms, it can really lull us into the sense that things are being treated. Everything's okay. But in truth, bladder can deteriorate and it might be completely too late because all of the damage is permanent and not repairable. BPH care is often framed around symptom control. Pills and coping strategies become the goal, but focusing on symptoms may miss what's actually happening to your bladder. Welcome to BPH 360, where bladder health matters. I'm Dr. Kuang, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions and take control. For education only, not medical advice. For your care, consult your doctor. Symptom relief is not the same as disease control. This is a really important concept for all of us to understand for BPH care. For far too long in modern medicine now, we've gotten ourselves into a bad habit where we're basing success on the metric of whether symptoms improve. And so specifically for BPH, we've gotten into this habit, hey, you've got a problem, Mr. Smith, take a drug. Oh, Mr. Smith, you still have a problem? Take a second drug. Oh, you still have a problem, Mr. Smith? Hey, why don't we go up on one of those doses? The issue there is now that we've kind of framed BPH as this chronic nuisance of symptoms rather than being about protecting a really important organ, your bladder. Remember, along with the brain, the bladder is the only other major organ that cannot be transplanted. You only get one, so we need to take care of it. And yes, your overall health and vitality are at risk when you don't allow your bladder to function properly, or you don't be proactive about protecting its function over your whole lifespan. And what we need to do is start changing the conversation from being about your symptoms. We've created this metric that things are successful if we've been able to give you medications and your symptoms have improved. And really what we've done there is just kind of mask the underlying problem, which is that as that prostate's getting bigger, remember that donut hole is getting tighter, creating a mechanical constriction, obstruction of the flow of urine, making it harder for that bladder muscle to work. Because remember, its job is to push that urine through that donut hole. And as that donut hole gets tighter, we're just making the job for the bladder muscle that much harder. So remember the symptoms that many men have, the slow flow, starting and stopping, taking a long time to start the urine flow, urgency, frequency, getting up multiple times at night to pass urine. All of those symptoms are really just signals that there's something bigger going on, and it's not necessarily being addressed if we're just trying to control or minimize the symptoms. A very good example, actually, is think about a brain tumor. And if you had a brain tumor, you might have a headache or you might have seizures. And we can give you medications to manage both. Tylenol, ibuprofen, medications to decrease seizure activity. But at the end of the day, if those headaches are improved, the number of seizures goes down, you still have a brain tumor there that needs to be addressed. The underlying problem needs to be dealt with. And so similarly, if your symptoms of urgency, frequency, getting up in the middle of the night to pass urine, slow flow are improving, those are just signals. And it does not mean that the underlying disease, which is that prostate could be constricting down, decreasing the flow, causing your bladder muscle to work harder, that problem has not been addressed. Another example is think about chest pain. You're sitting down for Thanksgiving dinner with your in-laws and one of them gets chest pain, shortness of breath, and that discomfort's radiating down their left arm. Well, it's not like you just give them an aspirin and their discomfort goes away and you call it a day because that's a success. No, you understand that those symptoms of chest pain, shortness of breath could be signals of an underlying bigger problem like a heart attack. Right? So you're going to rush them to the emergency room to do the proper data-first pro-diagnostic approach to make sure they're not having a heart attack, whether it's blood testings, an EKG, an echocardiogram, because you understand what's at risk. And we need to apply the same philosophy to preserving your bladder health for this organ that's non-transplantable, non-replaceable, and very, very precious to allowing you to live your best life incontinence-free and catheter-free. So remember that one key phrase that we talked about, symptom relief is not the same as disease control or disease resolution. That is something you have to do together with your provider, with your urologist, to find the right solutions which are beyond just managing your symptoms. Remember that feeling better does not always mean that you are actually healthier or actually protecting your bladder. I wanted to explain that for a lot of our men, we suffer from I'm fine syndrome, IFS. And it's really not that we're fine, it's just that we're fearful that if we explain to the provider that we're not doing okay and that we're suffering in silence from all these symptoms from our prostate and our bladder, that you're going to start doing tests to us. And what we need to do better is educating the community, all the men out there, that what's at stake here is really important. That's protecting your bladder. And the only way we're going to be able to do that is by choosing to listen to our bladders when our bladders are speaking to us, right? When they're saying, hey, I'm having issues, I'm struggling, my flow is slowing down, I'm getting up 3 times at night to pass my urine, I'm having urgency frequency, or actually I'm starting to even leak, right? Because what happens is that if we choose to ignore it, it allows our bladders to needlessly progress from stage 1 to stage 2 to stage 3 where you're leaking. Stage 4, you might show up in the emergency room because you stop peeing at all and need an emergency catheter, or heaven forbid, stage 5, where just like the heart can go into heart failure, the bladder can go into bladder failure, and you may need catheters for the rest of your life. And so often, when we just focus on managing symptoms, it can really lull us into this sense that things are being treated, everything's okay. But in truth, slowly over time, the bladder can deteriorate over 5 years, 10 years, 15, 20 years to the point where it stops functioning. And it might be completely too late because all of the damage is permanent and not repairable. And I think that's really important that we understand that when we have these symptoms, it's our bladders talking to us to seek help, to seek data, to seek testing, so you can make the best decisions about your bladder, about your body, based on your data. Remember, medications can often very effectively help manage those symptoms, but really what it's doing is it's masking the potential damage that could be underway and occurring to your bladder. So just make sure you remember that just because your symptoms are getting better does not mean that you're actually stopping the disease progression on the bladder. You're not stopping that very slow insult and damage to your bladder function. And we ask that you just reach out to your primary care doctor, your urologist, when you start having those symptoms, just so you can get this testing at a baseline, at a minimum, and then potentially you can be watched, or perhaps the data suggests that you need to act now before you're advancing too far into those later stages where the damage is irreparable. Don't be like so many men who enter those late stages, stage 4, where they're showing up in the emergency room in retention. And when we ask them, why did you wait so long? Too many men are saying, well, I thought it was being treated. I'm on medications. I thought that was treating the problem. And I think that misconception is really dangerous when you're thinking that your symptoms are improving while you're on the drugs, but in truth, your bladder continues to struggle and may eventually get to the point of such damage that it can't function at all. Quick pause. This is a serious moment. If your urine flow is very slow or you're having worsening urgency, leakage, or retention, that can be late-stage disease. At that point, supplements and pills may not be enough. On manvsprostate.com, there are simple tools to help you see where you may be on the bladder health stages and whether it's time not to wait, and to go see your doctor and to ask, What about my bladder? Learn more at manvsprostate.com. Back to the episode. These are exciting times for BPH. There's so many new tools and diagnostics and therapeutics to help men make the best decisions about their prostate even faster, as we highlight what is at stake by choosing not to take action. And now we can really show men using the 5 stages of bladder health that let the symptoms be the words that we hear from the bladder, and let us heed them, and let us act upon them. Let's get the diagnostic testing. Let's get the right therapies in place. If a man truly has what we call an obstructing prostate, right? Prostatic bladder obstruction, with the right testing, understanding the right size, the right shape of the prostate, as well as the status of bladder health, we can choose the right interventions. Because prostatic bladder obstruction is a mechanical problem that deserves a mechanical solution when warranted. But we first need the data. And when we simply choose to manage symptoms as our top priority, we get lulled into this sense that we're treating the problem when drugs temporize or minimize the symptoms. But in truth, that bladder muscle continues to struggle, and it really kind of muzzles the bladder. We need to be proactive about choosing to listen to the bladder when it's speaking up and it's causing you that slow flow, causing you the urgency, the frequency, the leakage, getting up multiple times at night to pass your urine. It's not simply acceptable anymore for men to put up with this. Together, we want to see you earlier on when you're in stage 1 and stage 2, right? And then we can use the data from the proper testing to ensure that we don't allow you to get into those later stages of stage 3 leakage, stage 4, the emergency room visit for not being able to pass your urine, and stage 5 when your bladder muscle can actually fail, committing you to a lifetime of catheters. Remember, together, our mandates are to preserve your bladder health, to prevent late-stage disease so you can live the best life possible, incontinence-free and catheter-free. It is such an important part of your health overall so you can live not just longer, but also better. Some takeaways. Managing symptoms is an incomplete strategy. Symptoms is your bladder talking to you to seek help, to seek your data, seek diagnostics, so you can make the best choice for yourself, for your body, and for your life. Symptoms are downstream signals, not the disease itself. And symptom relief can really mask the damage that could be already underway in your body, hurting your bladder. Bladder preservation health requires better questions, better data, so you can really prioritize the quality of your life and be the best version of yourself. Thanks for watching. If bladder health matters to you, watch more. Follow BPH 360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.